Experts warn about Omicron in children, advised to look out for barking kind of cough. The highly transmissible Omicron variant of COVID-19 is causing an unprecedented outbreak of illnesses over the world. Dr. Andrew Pavia, a pediatrician and expert on juvenile viral disorders, says the Omicron variation acts differently in children than it does in adults. However, because children are largely unvaccinated, some researchers believe Omicron's mutations may be affecting them more severely, the Sun reported. The pediatric infectious diseases specialist at Primary Children's Hospital in Utah said that there is evidence to believe that Omicron behaves differently in younger children. The medical fraternity is witnessing a trend toward increased sickness in younger children, which is most likely due to changes in the virus. The variant targets the upper airways rather than the lungs, and younger children's airways are smaller. The majority of children who have contracted the virus and become ill enough to require hospitalization have a distinct cough. Doctors have described the sound as croup-like and barking. This type of cough is usually harmless, but it is upsetting for parents to hear and can induce anxiety. As children's nasal airways are so small, they can easily become obstructed. This is why, when children breathe through inflamed airways, it can easily irritate and trigger a dog or seal-like cough. As a result, a slight cold in an adult may cause a youngster to struggle more, as they may find it difficult to breathe. Because Omicron collects in the upper airway and produces inflammation, children may experience a worsening cough and require further assistance to breathe properly. Previous versions of the virus would travel deeper into the lungs, resulting in a more serious disease. Despite the fact that Omicron is sending fewer patients to the hospital, Dr. Pavia says he is seeing more children under the age of 1 come to the wards with breathing problems. It is possible that COVID is to blame if the youngster comes home with a sniffle, a headache, or feels under the weather. What is critically important is that we need to keep an eye out for symptoms in children that could indicate Omicron and to continue testing to be certain.